This practical demonstration video covers Achilles tendon rupture rehabilitation, specifically flexibility exercises for range of motion benefit. For the right ankle on static and dynamic stretches shown at different angles. Early phase exercises are integral to rehabilitation. All exercises are non-weight bearing with neutral positions being shown. Inversion is a suitable exercise, emphasis on controlled entry and exit to the movement. Starting laying down with the unaffected limb out the way, the affected ankle hanging free from the end of the bed, the foot rolls inward towards the middle line of the body. The shank should remain level while the heel is directed across, allowing the foot to be led. This exercise is suitable as it will provide familiarity to the uninjured but weak tissue surrounding the Achilles tendon for support in later stages of rehabilitation. Therefore, no plantar or dorsiflexion should be applied. Exercise should be a controlled static stretch for 20 to 30 seconds, which is shown over 3 angles, with 2 to 4 sets, 2 to 3 times a week. Inversion can also be progressed with the use of soft resistance, ordering the foot into inversion and then applying pressure into the cushion shown. The outside of the foot and toe should be the primary point of pressure, and no resistance should be so great that it rotates the foot into pain or into plantar or dorsiflexion. Adding resistance to exercise provides a strength training component. This progression will improve the strength of surrounding tissue for greater stability at later rehabilitation. This is also a static exercise for 30 seconds. However, entry and exit from this movement should come after the release of resistance. Next exercise is eversion, an opposite but equally suitable movement if controlled entry and exit is applied. Starting laying down with the unaffected limb out the way and the affected ankle hanging free at the end of the bed, the foot rolls outward, away from the midline of the body. The shank should remain level while the toes curl under, and as the heel directs the toes will uncurl. For the same reasons as inversion, the exercise is suitable in providing familiarity to the tissue surrounding the ankle for later phases of rehabilitation. No plantar or dorsiflexion should be applied. Eversion should be a controlled static stretch for 20 to 30 seconds, coupled with the inversion stretches. Similarly to inversion, the progression of the stretch involves soft resistance presented by a cushion. The point of pressure should be made on the inside of the foot and toes with the entry and exit of the movement without resistance. This stretch will build tissue strength around the Achilles and should be a static hold for 30 seconds. Overall, the early phase rehabilitation exercises allow for slight movement but consistent and controlled benefit for later. Range of motion can be viewed from the angle of the foot from the shank. Mid-phase rehabilitation is still non-weight bearing but does now involve movement in a directly affected plane of motion. Plantar flexor exercises consist of movement opposite to extending the Achilles tendon but should still be controlled and not exceed neutral. Laying down with focus on the affected ankle, the foot should point away from the body. There should not be such excessive plantar flexion that the foot and shank are flat, but instead allowing the heel to direct towards the floor and the toes to hold pointed slightly above the ankle. Will allow tissues with correlating opposite function to find familiarity and control any undesired dorsiflexy movements. This stretch can be performed as a 30-second static hold shown across 3 angles, or the stretch can be performed dynamically with 5 repetitions. When performing dynamic movements, the entry and exit should still be controlled even if repeated. The return to neutral should not exceed neutral. Watching these repetitions, it is clear that the shank remains level while the heel and foot direct towards the floor in a controlled movement. Then holding the position for 8 to 10 seconds, the foot can rise up back up to neutral. After a brief stationary period at neutral, the ankle can plantar flex again, but should not be rushed in the movement. There should be an attempt throughout to keep the movement directly in the plane affecting the Achilles tendon, and so no inversion or eversion should be applied to this exercise. This is particularly important in the entry and exit of the stretch, along with importantly not dorsiflexing past the neutral accidentally. This exercise dynamically can be performed in the same sets and weekly frequency as the static version. A progression for the stretch involves adding resistance to the plantar flexion movement. By adding a resistance band or even a non-elastic material, the dynamic version can be improved. Placing the loop of the band in the arch of the foot under the ball of the foot and holding the other end of the band will create a greater resistance in the motion. The foot will not plantar flex as much as when not restrained, and so the same angle should not be attempted to reach, as this may cause damage. Entry and exit of the motion will occur with resistance already available, however slack in the band would allow for more comfortability. At no point should the band be used to return the ankle to neutral, as this is extremely dangerous and may cause the ankle to pass neutral and dorsiflex beyond the Achilles tendon's capabilities. This exercise should not exceed 5 reps. Dorsiflexion at the ankle is the primary role of the Achilles tendon. While sitting, keeping weight on the unaffected limb, apply light pressure to the floor with the affected limb, firstly raising the toes and then the rest of the foot except the heel. Attempt to have the knee at a right angle and therefore an appropriate chair is needed. This stretch should be 20 seconds as shown across these two angles. This movement allows for active and controlled dorsiflexion. If any pain is felt during this exercise, then cease immediately. Another dorsiflex stretch in preparation for late phase rehabilitation has an increased risk. Starting sitting in a similar position to the previous stretch, hold the affected foot with pressure exclusively on the toes in a plantar flex position. Slowly lower the heel towards the floor, however do not touch the floor. If this is not possible, then decrease the angle at the knee. This should be a static stretch for 20 seconds total and could be repeated in 2 to 4 sets. Having a supporting person to guide the movement may be beneficial. Regarding range of motion, late phase exercises typically develop on a separate component, for example strength training. The ankle should have a mostly healthy range of motion available. An example of this being the squat. When standing, position both feet shoulder width apart. This is a full weight bearing exercise. While maintaining a level back posture, bend at the hip and knee so that the knee from the participant's perspective covers the toes. The benefit to this exercise is using multiple components of rehabilitation training to prepare for an integration into return to sport. A squat using the range of motion benefits previously developed, strength training to support full weight bearing, and stability to maintain composure and not apply inversion or reversion inappropriately. This exercise can be performed as a 30-second static stretch as shown in the previous 3 angles, but can also be performed as an 8 to 10 second dynamic movement in up to 5 repetitions. The dynamic stretch may be performed quicker with progression, however it would be advised to have a supporting person check form. This exercise allows the ankle to dorsiflex with body weight applied. As we can see from this demonstration, from standard standing position, the ankle of the knee decreases as the top of the shank is brought forward, meaning that maintaining a flat contact with the feet will dorsiflex the ankle. The exit of the position should be brought about by a combination of work at the ankle and at the knee to propel the leg straight back. However, this should also be smooth and controlled. For further progression, instead of speed of movement, the participant could also position their feet wider to apply the flexibility of inversion and eversion movements, as well as strength and stability. Thank you for watching this practical demonstration based on Case Study H by Bradley Smith.